Wow. Health challenges in Uganda, and you heard it for yourself from different people who are not prompted, but they know. We've talked about access, affordability, finance, partnership, mindset, corruption, raising awareness, information, and just to mention the few, because I do believe there's a lot of other more challenges that we can talk about that is really hindering the people in Uganda to get the best care they need, health care. So what those problems do deliver, though, to us who are sitting in this think tank today, they deliver opportunities. Those are business opportunities that we can partner and actually bring the solutions in Uganda. So hopefully today, it is a day that we come up with that, because I am feeling quite energized. I am feeling the room is wanting to get solutions. I am feeling the room is, driven towards making it better. And I loved when I had the young man here speaking, Andrew Wetaka. Andrew Wetaka, the chairman, was speaking and talking about, we're talking about such kind of young person who has put himself forward to be a leader. But for him to be there, he had to have a mentor. And mentorship is something we can do to empower those in Uganda, those who are here, to give better services. And I was quite encouraged because I come from a teaching background. I'm an instructional coach. I've been a teacher for a million of years in the United Kingdom, and I know that you're better nurses, you're better doctors because there was a teacher somewhere or a mentor somewhere. Our next speaker is going to be speaking to us about strategic leadership and operational management. But I already saw his success from when the young man said, my mentor. I'm calling Dr. Maimuna Mushabe. Give it up for Dr. Maimuna Mushabe. We have talked a little bit and she is really encouraging. Thank you very much, Dr. Maimuna.
Good morning. I'm privileged to be here to share my passion. So my passion is about improving children's services. That's my passion. So I'm Dr. Maimuna Mushabe. I'm a pediatric consultant in the NHS. My area of expertise. My area of expertise is children's epilepsy. And there's a background to that, but I'm also very passionate about leadership because very early on in my career I realized that if you're not on the table to discuss and influence decisions, then you can't contribute or improve services. So hence the reason why I'm so passionate about clinical leadership. So I'm currently the interim CEO of Basildon Hospital in Essex for people who live in London or England. And it's one of the largest DGHs in group hospitals, Mid and Sussex hospitals, serving about 1.8 million population. So big catchment. I think we talk about opportunities and access, but I really want to take us back as Ugandans. I'm Ugandan born. I trained in Uganda. My undergraduate is from Uganda, and I feel very privileged and honored that I have that root and grounding in Ugandan society and upbringing, which builds on to where I am today. I left Uganda after my medical graduation because I met someone who said, would you like an opportunity to go in the UK to do your postgraduate training? So I came into the UK, I did my pediatric training, I completed. And as I completed my training, I did my last rotation at Evelina Children's Hospital. My education supervisor said, what do you plan from here? You now have the skill, you're equipped, you're a doctor, you're a consultant, what's your next step? And I said to him, I'm really interested in leadership. I want to understand how I can contribute to a bigger scale, more than just looking after children. How do I influence the decision making? Recognizing my background, which at times holds you back as a Black woman in a United Kingdom culture. How do you go to the big table to influence? And he said to me, choose wisely where you take your next step. do some training, but we'll mentor you. I'm happy to mentor and continue to be your coach as you take that next step. So I ventured into clinical leadership, and that's where I am. On the next slide, I really wanted us to think about talent. So we all Ugandans in this room are very talented. Most of us have trained in Uganda. So Uganda is not short of talent at all. But how do we build the opportunities that unlock our potential? I think is what we really need to think about as Ugandans, particularly in the diaspora. We have an opportunity, we see what good looks like. We know how the United Kingdom, for example, aspires or the ambition to make healthcare good. We talked about corruption. How do we as Ugandans go back and change that mindset and realize that it's not about the government, it's not about the president, but it's us who are going to change that. So how do we work together, open the opportunities, mentor our talented Ugandans to make healthcare good? We talk about leadership. We are all leaders in this room because we've taken the time out of our busy Friday to be here to discuss, to link, to share opportunities. We're doing leadership. I personally, I don't think it's anything special. I think we use the big word, but what we are doing today is leadership. How do we as leaders in this room then continue to unlock and create opportunities for the talented Ugandans for us to arrive in a space where healthcare is accessible, is affordable, and is good? Why do we have to go to India to get that treatment? Why is it not available to us as Ugandans when we have the talent? So then it brings us to this expo, how we connect and work together. How can we connect with the systems that we already have in Uganda? We have universities, we have medical school. I trained in Mbarara University. When I first went to Mbarara University, I was lucky. I wanted to go to Makerere, and then I thought I still want to be close to my parents. I'd never gone beyond Masaka. So I was really feeling comfortable in Mbarara for people who come from Uganda. So I thought, you know what, I'll stay close to home, to the place where I understand. And I remember those days people say, oh, Maimuna, you're very intelligent, you did really well, you should go to Makerere. But I've come from Mbarara, and I've been lucky because of opportunities, support, and mentoring to be where I am. So it's really not about the institutions. I think we have the institutions, but how do we make them better? This is what I want us to discuss today, linking and really think about as we develop this expo. How do we invest in our people, in our systems, in our enterprises? And I guess COVID pandemic was grateful, but it created an opportunity where you don't have to be on a flight to Uganda. You can provide a lecture, you can do webinars, you can link with a massive population in a very quick way without spending much money. So how do we do that? Reach out to our universities, reach out to our schools, encourage our youngsters who are coming up to go into healthcare, do medicine. I was speaking to Janet earlier, so I support lots of young people through work placements who are interested in doing medicine, because I recognize as our children from a Black background, at times they don't have that opportunity. I would like to see more. How do we scale up that and work together? So I guess here in this room, as talented people who can give those opportunities through mentoring, coaching, giving direction, how do we link together through this expo going forward so that we can see that it come to fruition in terms of investments, in terms of unlocking. I'm interested in unlocking healthcare in Uganda because I think we can do it. I believe, and I agree, mindset is really important. We really need to think about small things, making them big. It's not about money. It's about us who are working in that system. So I'll stop there so that we can have a discussion. So if anyone has any questions, please let's discuss.
My question, Madam, is having been through the healthcare in New Zealand, where I'm from, and also in Uganda, the talent in Uganda and the affordability is actually quite phenomenal, and the treatment was incredible. So is there any potential to sort of export or import that education or skills in the sense of it genuinely was, you know what customer service is? Mm-hmm. For me, I felt like I was treated so well, whereas in New Zealand, I felt like I was treated like a piece of paper. So I genuinely am grateful I had some health issues in Uganda and I was amazed by it, but then that's because I was in a position to have that healthcare. So how can we, through the power of media, social media, whatever, which is what I can do, how can we do that to help more? Is there a platform, is there a potential to highlight that actually the skills and education there is quite impressive? How can we help? And what would your advice be to the leaders of someone like my country to help make it more accessible for people?
Thank you. So I'll give it a shot. I think for me is that we have the talent. We are very intelligent people. Ugandans are hardworking. It's not that we are not hardworking. I think we work really hard, and I think the current generation particularly is really hungry for opportunities because they have potential. They can see where things could get to. But it's how do we organize ourselves in partnerships like this. So us in the diaspora working with our colleagues on the ground in Uganda to make things possible. How do we do that? And it's through expos like this. It's through networks. So at times I find myself really isolated. I'm thinking I really have a lot of knowledge that I would like to share. How do I share that? So it's creating those. Thank you. Is creating those links. We need to widen our networks, and I insist on Uganda. I know we are all Africans on a wider scale, Africa, but Uganda particularly, we need to widen our networks. We need to recognize that if we work together, we will make improvements for our country, and this is really important for us because that's where we can start those discussions.
Thank you so much, Dr. First of all, congratulations. You're an interim CEO. That is very powerful in the NHS. One of the reasons for me to come here, I'm trying to support the association, the Uganda Nurses and Midwives Association, where we've got specialists. We don't have specialists back home and many other lower-income countries. So that's number one. We've also got the doctors. You mentioned you want to, mentor our young doctors. What does that journey look like? By the way, we've also got the allied health professionals. We're trying to support them, to have that visibility, etc. What does the journey look like? For example, if we signed an MOU today, we've got a draft ready, by the way, and we'll bring it to you. And we'll bring it to you as a CEO, a decision maker, policy maker. What does the journey look like? If, for example, I had 5 doctors, 5 nurses, 5 allied health professionals they could come for fellowships, come for, observerships. What does that look like? And what does it take to get, the signature from you as CEO?
Okay.
Thank you.
So thank you. I think that's a really good question, and I made my slides really brief because I didn't want to go through the whole journey. So what does that take? It means that the starting point, I'm here and I'm willing. And what that really takes is that opportunity for that doctor who wants to come and do a fellowship or observership linking them. The NHS is great in terms of it has systems, but it can be very difficult and widely to navigate. So it's really understanding how we navigate that system and get into the right place. So I'm here, I'm willing, and I'm happy to support people. So if there's any doctors who want to come and do observership, do clinical fellowships, I'm happy to support.
Thank you.
Sorry.
Can I then put you a challenge?
Yes, please.
You're CEO of a trust hospital. In the UK, we throw away second-hand kit. What about you trying to get all that kit together, all the walking frames, all the glasses? People going to get new glasses. They discard their old glasses. Those glasses work. They've got a prescription behind them. And we have someone in this room who flies regularly planes between here and Uganda. So why don't you have a chat together? And there must be someone in this room who's got some clinics out in Uganda who would desperately want some of that kit. There's plenty of people out there that can sterilize it, that can clean it. We can get over those issues. That is a partnership. You provide the second-hand kit, someone else will fly it out there. Let's find a third person who can take it and use it, and that's an outcome from this conference.
Before you answer that one, I can start with Monica here. Monica, I'm going to give you a challenge as well from there to you. I get glasses, second-hand, and some new ones as well. But the biggest challenge is that shipping them is costly. I'll give an example. I got a consignment of about 1,000 glasses. It cost me about £400 shipped to Uganda. It cost me $150 per doctor, ophthalmologist, 10 of them to go to those medical camps for my own money. So shipment, payment for those doctors, hiring places, medical, there's so many things going on. Is there anything we can do MOU with Uganda Airlines to at least, even if it's 50%, such things? Because there's a lot of wastage in this country, a lot. From AEDs, glasses, walking Zimmer frames, there's so many elderly people need them. There's a lot. Even hospital beds. And yeah, another thing, the policy, going back to again, the policy makers, Uganda's put a ban on the second-hand items. They're still functional. The medical staff, they're still functional here. You bring them to Uganda, you pay a lot. It costs a lot to bring to ship, then you pay a lot in taxes, and it's a challenge. Our people need them. So it's a challenge to both of you. Think about it. You don't have to make the show now, but think about it, please. We are here. For me, I do a medical camp at least once a year in Uganda. In December, I'm going, and I need support for that. Thank you very much. There's another question here.
Thank you very much, CEO. My name is Asha Rukondo. I am a nurse by background, and I've been running a charity for over 10 years. And what means for me, I've got people in Uganda that I support. We go to the hospitals, we go to the children wards, and here I take things back home, like if I happen to get medical staff, I do take them there, and everything that that is needed down there. And for my challenge, as this gentleman just said, actually you just said what I was going to say, the challenges that I get as a person is when I go to a hospital, like Mulago Hospital, any other hospital in the village, normally I want to go in the villages to kind of see these people, and they don't have equipment. So, for example, in May, I was in Uganda, and I managed, with my little money, to take 2 suitcases, whereby I had to go around and give things to these people, like it could be like children, and we did like health promotion as well. And I found myself that, out of my pocket, I've got to look after these people. So it's actually good for us to know, how we can work together in things that maybe you can give us, like equipment or things that, can help, improve people's health back home. Because I went down to the village and I found this child had 2 legs amputated, and also had a sister who is actually has got, I think, a heart problem, something like that. They all come to me. I can't really, give them everything that they need. But if we have a collaboration, like we've got people that are going to be there to stand with us, because my charity, I don't get money from anybody. It's just a few people that come to me say, Asha Love, we're going to support what you're doing, and that's all I can get. But if we get people like you or other people that say, you know what, we can stand with you, we can stand with other people, other organizations. We've got Charlie Muga as well. I mean, we can do something really good for people back home. Thank you very much.
Thank you, Athash. So what I'm hearing and what we're discussing this morning is how do we collaborate, but how do we scale up and leverage on the systems and the things that we already have in place? How do we, collaborate with the Ugandan government, the health secretary? So Diana was not my batchmate, she was 2-3 years ahead of me. She's the health secretary of state. Is how do we then open up those conversations? Because it has to be two-way, bridging between the UK and Uganda to make this happen. There has to be that conversation and that support on either side of the continent. So I'm happy to be on the table to discuss and support, but it has to be a way to bridge that gap. Someone at the back. Hiya.
Hello. The last question, please.
Yeah, thank you so much, and congratulations for your interim CEO. Such inspirational leadership. My name's Alison Sane. I work in an oncology hospital, and over the last 2 years, I led some global mentorship between colleagues in the UK and colleagues in Uganda. And the mentors we had were UK-based Eurocentric mentors for Ugandan colleagues, and it was really evident through that process that there was a lack of cultural awareness around the environment that colleagues are working in and under challenging situations. There was also a gap between what is a teacher and what is a mentor and what we mean by mentoring. So we have an opportunity potentially to bring diaspora Ugandans on to really understand and be trained in how to mentor opposed to how to teach, and how to help people fish rather than provide the fish. So perhaps my offer could be to create something. I'm an executive coach and mentor, and I would be happy to work with Diaspora in Partnership to create a mentoring scheme to support diaspora colleagues to learn the art of mentoring so that it's more appropriate to these skills, and we also deliver that through a virtual platform so it's free to access. Thank you.
Thank you, and that's a beautiful offer, and again it goes back to creating opportunities, working in partnership and scaling up and leveraging on what we already have. So thank you for that offer. Asha did, or someone else asked about, I think Hajara, about what we can do to help, for example, some of the doctors who want to come to the UK to do clinical fellowship, observership, and it all goes back to that. We need to create a platform where people know where to go if they needed support and mentoring. And I don't want to say it here lightly because it takes time. You need to create the time. You have to have the intention. We have to start being intentional as Ugandans in what we want to achieve and how we want to do it. But we can't do it without changing our mindset about it. So thank you so much for the privilege to be here. I think this is great, and I want to thank Andrew. So I'll tell you how Andrew came across to me, and that's what I mean about being intentional as Ugandans. So Andrew works in the same hospital as I work, and I was walking, and he came to me and said, "Oh my God, I've been looking for you." I said, "Okay." I had to stop, and he spoke in Luganda, so
straight away. That's attracted my attention, and he talked to me about this, and I was very pleased that he took the time to stop me and speak to me about it. And then we started talking, okay, who is the other Ugandan in Basildon Hospital? And we have lots of Ugandans. We have cardiologists, we have senior managers who are Ugandans, the chief pharmacist for the hospital is a Ugandan. So we have lots of talent, but we are not networking, we are not linking, and we are not collaborating, and we need to do that more. Thank you.
Of hope. Doctors, nurses, innovators, leaders, entrepreneurs reaching for the sky, investors bringing new possibilities, helping every dream to fly. Every connection is a blessing, every partnership a flame.